Hey, what's up, everybody? Welcome to my channel. My name is Tamisha, the Codepreneur, as well as your transformational coach here on YouTube, keeping it raw, real, and relatable. And in this video, I'm going to give you guys my top 6 must-have items that you should be carrying with you when you are working in home health. If you want to know what those are, go ahead and stay tuned. All right, so the first must-have item that you should have when you are working in home health is a watch. Yes, a watch. You are going to need a watch because when you're working in home health, timing is of the essence. Timing is very, very important. So you want to make sure that from the time that you arrive to the time that you leave, you are keeping track of that. So you have enough time for drive time in order to get to your next client. All right. So definitely need to have a good and reliable watch. Next thing you're going to want to have is a blood pressure cuff and stethoscope. Okay. You can either get the manual ones or you can get the simple ones that go on the wrist or the around the forearm. Very, very important that you have a blood pressure cuff because this is something you're going to want to document, especially when your patient is not feeling well or they might be complaining, or if they have history of high and low blood pressure. You want to be mindful of that. You should just make it a good practice and habit. I know when I worked in a skilled facility and when I'm seeing patients, it's always a good practice to take their blood pressure. So you could document this. So if anything kind of seems out of whack, you have that there. I know a lot of time nursing would come up to us and be like, did you get the blood pressure reading on this patient at a certain time? And lo and behold, I have it, and they will be very happy because they'll just record what I had taken. Now, when you're out there and you're by yourself and you're working in home health, it's very good practice to make sure you're recording their blood pressure so you have that documented, as well as knowing how to get their heart rate. I'm going to couple this with blood pressure cuff and stethoscope, and I'm going to also say / your pulse oximeter. All right. So you want to make sure you have your pulse ox. So you are recording their blood pressure. You are recording their heart rate. You should know how to do that. And also you should be recording their pulse ox. Now, if for any reason the one that you're using, if you're using, manual with the stethoscope, then obviously you're going to need to be able to take their heart rate down. But if you are using one of the traditional ones that you can carry with, as you can see in the picture, then that's going to give you their heart rate anyway. All right. All right, now the third must-have item that you should be carrying with you when you are working in home health is a Theab Band. Theab Band. If you see my video here, you'll see how I use Theab Band to train my patient on upper body and lower body dressing, right? But you can use Theab Band for, of course, your exercises. So this is just something that's lightweight, easy to carry instead of walking around with dumbbells. Because that can get really hefty and make it very challenging for you. So if you walk around with TheraBands, then you can have different level of TheraBands, and I'll show you guys a picture of that, which is very convenient, and you can do different exercises with your TheraBand. Number 4 must-have items is your gloves, your wipes, and your sanitizer. All right, you definitely want to make sure you are walking around with gloves, your sanitizer, and your wipes. All right. You want to make sure that you are protecting yourself as well as the client you are working with. Okay. And of course, healthy practice is to wash your hands. Okay. So, I'm sure your clients wouldn't mind you using their bathroom to wash your hands before you leave and go to the next client or even upon arrival. So this is just a good practice. If you don't have access to washing your hands, this is where the sanitizer come in. And of course you have your gloves as well. Number 5 is gait belt. The gait belt. I know this is like ancient when you hear people talk about gait belt, but when you are going into the field, it is really a good practice to have a gait belt. If you guys go to my store, I have some. You can definitely go ahead and purchase it right there on my store. But it's very good practice to have a gait belt, especially when you are on the field, out and about on the field by yourself. God forbid your client falls when you are working with them at home. Let's say if you were doing functional mobility, maybe you were doing a functional transfer, and just say something happens, you could document that you were using the gait belt. All right. So it's just a good practice to have this is for your safety as well as their safety and just protection altogether. Number 6 is an iPad. Yes, an iPad. You want to have an iPad. This is very good for point of service documentation. It's going to help you stay ahead of the game and not falling behind, nor taking work home and having to work on it. I mean, sometimes you're going to probably need to take some work home and get it done, but for the most part, if you can travel with your iPad and document, let's say if they're in the middle of exercises, you can kind of document what what you're going to be planning and what you're going to be doing. You could document how they're doing the progress or whatever you need to do, but having an iPad would be very, very beneficial, and it's going to help you extremely with time management. And number 7, this is a bonus. This is not a must-have, but it's definitely something to consider. Number 7 is you want to walk with any adaptive equipment or assistive device that you can carry. Okay, so that might be you're walking with a reacher. That might be that you're walking with a socket. Whatever you're planning or working with is a good practice to carry. This is not necessary, but it's something good to carry. If you see one of my home health videos right here, you'll see that I'm using adaptive equipment. All right. But for the most part, your top 6 items that I mentioned is your most must have. Keep in mind, as OTs and CODAs, you are going into someone's home, so you should be utilizing what is within their home as part of their treatment. All right. You should not need to be carrying a whole bunch of stuff to them. Your focus is really helping them get independent in their setting. All right. Hence home health. So I hope that this was helpful. If you guys are loving my content and you want more videos just like this, don't forget to go ahead and leave it in the comments below. Make sure you are subscribed to this channel. Please, I love all the comments, so please go ahead and leave it. If there's a topic that you want me to talk more about, leave it in the comments below. I would love to discuss it with you. And until next time, guys, bye-bye.